Japan's experience and discuss how we might explore the possible pathway together. Okay, this is outline of my talk. And first, I'd like to begin by sharing an overview of the current and future trend of cancer in Japan. And next, I will talk about our collaboration in the activity of Forum for Nuclear Cooperation in Asia, FNCA. Then, let me introduce the Japanese Society for Radiation Oncology, JASTRO. And finally, I'd like to mention about the history of Filipino radiation oncologists as a personalized collaboration. So this figure shows the cause of death among Japanese people. The cancer is the leading cause of death since 1981. And this slide shows changes in population structure in 2025 and 2040. Okay. There are many findings from these figures. Number one, increase in the population aged 85 and over. Number two, increase in the population aged 65 and over. Number three, decrease in the working age population. And number four, decrease in total population. So, how does it compare with other countries? So this figure shows percentage of population aged 65 years and over by Asian countries. The aging is progressing in other Asian countries as well. So next question is, what is the association between population aging and cancer incidence? So this figure shows the age-specific cancer incidence rate in Japan, and the incidence is higher among people aged 65 and older. So, with the declining total population and the rapidly aging society, will the number of cancer patients increase or decrease in the future in Japan? The answer is here. Cancer incidence will increase slightly until 2040. And strikingly, the number of elderly patients aged 85 and older will significantly increase. So what about a demand for radiation therapy in Japan? This figure shows the future demand of radiation therapy in Japan. It showed significantly increased demand in the future. Okay, so now I can say there is a strong need for cancer treatment that are suitable for elderly patients in Japan. And radiotherapy is a very important solution. Okay. So, Forum for Nuclear Cooperation in Asia, FNCA, which is a Japanese government-led cooperation framework since 1993. The purpose is to establish safe and effective treatment for predominant cancers in Asian countries. Our activities include clinical trials for cervical cancer, nasopharyngeal cancer, and breast cancer, and brain mets from non-small cell lung cancer recently. The participating country is such 12 countries, and Bangladesh participated FNCA since 2007. So this slide shows FNCA clinical studies on cervical cancer since 1993. The first trial was radiotherapy alone for stage 3 cervical cancer. The second was accelerated high fractionated radiotherapy because at the time of this, majority of countries couldn't use concurrent chemotherapy. So instead, we used hypofractionated regimen instead. The third protocol was concurrent chemoradiotherapy using weekly cisplatin. The fourth study was concurrent chemoradiotherapy plus prophylactic para-aortic radiotherapy. The fifth, the latest protocol was concurrent radiotherapy using CT-based image-guided brachytherapy. So since the fourth protocol, Bangladesh participated the FNCA activity. And in the next year, we will start a new protocol using IMRT plus CT-based IGBT for cervical cancer. So let's compare the two clinical studies outcome, cervix 3 and cervix 5. So this table summarizes the patient background, treatment, and the clinical outcome between cervix 3 and 5. In cervix 3, conventional brachytherapy was used, but in cervix 5, CT-based brachytherapy was used. Other eligibility was same in both studies. So when we look at the clinical outcomes, local control in cervix 5 was better than cervix 3. Without increasing of severe late toxicity in the GI or GU. So this local control is comparable to the latest prospective study in Japan and Embrace. So the clinical outcomes of FNCA trials have been published in a distinguished international journal like this, and we are waiting the new publication about cervix 5 outcomes. And for cervix 4 trials, Dr. Banu from Bangladesh listed firstly in our activity. So these pictures shows the FNCA workshop held in Dhaka 2018. The picture of Dr. Banu and Kamal and other members. This is a meeting on clinical studies. We also had a tour to Delta Hospital and United Hospital. We had a hands-on training on 3D image-guided brachytherapy and open lecture at the National Institute of Cancer Research Hospital. Yes, this is very good framework. However, there is a weakness in the FNCA collaboration framework, a limited membership and few opportunities for participants, because this is a close member and a fixed member. Okay. So next, I would like to introduce Japanese Society for Radiation Oncology, JASTRO. The JASTRO was founded in 1988 and now has over 4,500 members, including radiation oncologists, medical physicists, radiation therapists, and nurses. Its mission is to promote the advancement of academic and scientific technologies through collaboration and by encouraging research in the field of radiation oncology and related areas. This is a picture of a board of directors, and I am one of them. Okay. So JASTRO has 24 subcommittees. These are a list of subcommittee, editorial committee, publication relations, and education, and quality assurance, and guideline, radiotherapy promotion, medical specialist system, database, medical safety, academic, committee and nominating committee for award, and international committee collaborating with other abroad societies. And terminology, particle therapy, medical physicist, health insurance, liaison, faculty certification, facility certification, and palliative radiotherapy, finance, and general affairs committee. I'm chair of this committee, and ethics, statute, future design, in total 24. And each of 20 board members is in charge of a committee. So our annual scientific meeting gathers more than 3,000 participants, making it one of the largest oncology conferences in Japan. Second, we also organize educational programs such as the summer seminar for young oncologists and a joint estro-gastro schools. We run a board certification system for radiation oncologists and accreditation institution. Number 4, guidelines also developed for IMRT, SBRT, brachytherapy, palliative radiotherapy, and many other fields. Number 6, for patients and the public, we prepared booklet, host citizen lectures, and even create a manga to explain radiotherapy in an easy way. Okay, this is a poster of the meeting. Just annual meeting, high precision EBRT meeting, and brachytherapy meeting. And particle therapy meeting will come soon. This is educational programs, summer seminar, seminar for student resident, and biology seminar, physics seminar. The most seminars are performed in person, and only Japanese is used. So we are sorry for not sharing with you. These are guideline development for external beam radiation therapy and brachytherapy. Okay, we have our own official journal, Journal of Radiation Research. This journal is fully open access, multidisciplinary journal that publishes articles in radiation science in the field of biology, chemistry, physics, epidemiology, environmental sciences, and clinical oncology. I'd like to share some articles from JRR. The first is the gastro guideline translated in the English version on esophageal cancer. You can see many our policy and the representative delineation for the esophageal cancer. Please download it. The next is guidelines on uterine cervical cancer written by me. First one is recommendation for high-risk CTB definition using CT. Okay. And second one is intracavitary and interstitial brachytherapy for gynec tumors. These are public engagement. We have public lectures, patient booklet, and YouTube. This is a very famous actress in Japan, and she had esophageal cancer and received radiotherapy, and we had a promotion video on YouTube. The last one is a manga on radiotherapy success for cervical cancer and esophageal cancer. We also have PR activities through the Gastro homepage, Q&A and movie, books, etc. So this is the international collaboration by Gastro. We have joint symposium with Astro, and which are held alternately every year in each society's meeting or independently. We also have Japan-Taiwan Radiation Oncology Symposium and Japan-China-Korea Trilateral Symposium and FARO. And JASTRO is one of FARO members organization. Okay. So lastly, I'd like to introduce a story from a Filipino radiation oncologist. Okay. You can see the female faculties. She stayed at our department for 1.5 years to learn gyne brachytherapy. Especially, she wanted to learn intracavitary and interstitial needle or hybrid brachytherapy in our institute. And after she back to the Philippines, she became a teacher and she hosted hands-on training workshop in the activity of PROS, Filipino Radiation Oncology Society meeting. And this picture shows she instructed applicator insertion using the phantom. The phantom was originally developed our department, and that young doctors can insert the applicator under the ultrasound guidance. Okay. So we were invited to the workshop, but we didn't interrupt such educational program. We could just see. So, for example, she tries to insert the applicator, not only intracavitary applicator, but also interstitial applicator, needles, and which position or which direction or how long was the depth. Everything was instructed by a Filipino radiation oncologist, Dr. Jamie. Then please look at her smiling face. So this was very successful workshop. Okay. And this picture shows the difference in radiotherapy environment between the Philippines and Japan. The total population is larger in Japan, but is similar between two countries. However, the number of RT facilities and brachytherapy machine is quite low, less than 10%. Also, the number of radiation oncologists and medical physicists is less than 10%. So I felt Bangladesh has a similar, not same, but a similar situation as in the cervical cancer in the Philippines. The patient, almost 70% of patients need radiotherapy. So again, I'd like to emphasize the importance of training of trainer. Okay. So in summary, first, strengthening collaboration in radiation oncology between Japan and Bangladesh requires mutual understanding. Second, each country has unique strengths and challenges. Sharing knowledge, experience, and training can benefit both sides. Number three, sustainable partnership depends on the trust, communication, and cultural awareness. And I hope such smiling can be seen in this country. Thank you very much.
Thank you very